So you've been diagnosed with Bell's palsy. Here's what you need to know and a little bit about what you might like to know. Bell's palsy is the same thing that affected Jean Chrétien. It heals in most people in 3 to 6 months. The younger you are, the more likely it is to heal completely. On one side of the face, you're going to get a lack of movement. Other symptoms might include drooling on one side of your face, tearing on one side of your face, a sensitivity to sound, and a change in your taste on your tongue on that side of your face. These are all symptoms related to the problem with the nerve that feeds one side of your face. We don't actually know what causes Bell's palsy, but we think it's an infection of the nerve that feeds the side of your face, the 7th cranial nerve, and it gets inflamed and it stops functioning properly, leading to all of these symptoms. Now, if you've been given an antiviral medication as well as a steroid, which is what we usually do if you come in soon enough, you must fill them as soon as possible. Stop on the way home from the emergency room. If you're watching this video, go out and get it now and take it as soon as possible. The sooner you take it, the better it's going to work for you. The more likely it's going to resolve completely if you get it in quicker. So do not wait. Other things that can happen when you have Bell's palsy is your eye does not shut completely. Now normally we blink all the time, and if something's coming out our eye we blink to protect our eye, but now you can't do that because the eye won't shut. So if that happens, you can get a very dry eye. So you should be taking some tears when you go to the pharmacy to pick up your medications. Get some artificial tears that you can drop in your eye during the day to keep it nice and moist, and at nighttime get the artificial ointment. You just pull down your bottom lid and you squeeze in some ointment and then shut your eye. If you are unsure, ask the pharmacist about how to apply it. And then while you're there, you can get these eye pads like I have here, and you put them over your affected eye, the eye that won't shut on its own, and you push that eye shut with the ointment in there, and you take a piece of tape. This is just paper tape. I'm not going to completely do it, but you put your eye pad on and you start from your forehead and go across your cheek. You never go over your nose. Too hard to breathe. Over here, and then go to sleep. And that will keep your eye protected during the night instead of getting dry overnight and ending up with a very dry eye by morning and potentially some corneal abrasions if you don't keep it closed. The other thing you could consider doing is getting some protective glasses. Now, if you already have some sunglasses that are nice and big and have side protection, like these ones, if a ball comes at you or some spray comes at you, this is protecting that eye that won't close on its own. If you happen to have some of those Terminator-style ones at home, you can use those. Those are great. But if you've got a big set, this is just fine. It will protect your eye, and wear those as much as possible while your eye is not completely shutting. Again, it should heal within 3 to 6 months for most people, although for some people it never heals completely. The older you are, the more likely that is to happen. The younger you are, the more likely it will heal completely. I'm Dr. Atzema, and those are my discharge instructions for Bell's palsy.